Hi, I'm Dr. Dipesh Naik, GP at Abington Medical Centre and Clinical Executive Director at General Practice Alliance. I'm here today to talk about the Northampton COVID Assessment Centre. This video will explain the patient journey from being referred from your own GP surgery into the service. Your referral into the service starts with your own GP surgery. Your GP will initially contact you either via telephone or using a video consultation. They will be assessing your signs and symptoms to see how severe they are. If they felt you needed a further assessment, they would book you into the second layer of triage, where a GP or an advanced nurse practitioner would then contact the patient and ideally do this as a video consultation. The second layer of triage will then decide if it's appropriate to put you through to the assessment centre. You will then receive a text message which will give you the details of where to attend and at what time. Ideally, you will then arrive at the Northampton COVID Assessment Centre, which is based at the Waterside campus of University of Northampton. As you arrive, you will see the sign to wait at the barriers and to switch your engine off. You will then receive a call from our receptionist working at the site, who will ensure that you are booked in and arrived at the service, and print off any relevant paperwork from your surgery. The reception staff member will then walk towards your car and place the paperwork in your windscreen. They will then signal to you to move forwards. You will then start driving towards the first porter cabin, which is the observation bay. Here you will be greeted by a nurse or a healthcare assistant who will be appropriately wearing the full personal protective equipment, or PPE. They will take the paperwork that has been put onto the windscreen and start to do your observations, starting with the oxygen saturation probe, which will be placed onto your finger. This will also test your heart rate or pulse. Your temperature will also be taken, as well as an observation of your respiratory rate or your breathing rate. All of these observations will then be written down on a piece of paper to again be put back onto the windscreen for the onward journey. At this point, a further examination still needs to be done, which is the 40-step saturation test. This will involve you needing to step out of the car to have the oxygen saturation probe on your finger whilst you walk 40 steps. This is to check to see if your oxygen levels drop with any form of activities. You will then drive on to the next bay, which is where the GP or advanced nurse practitioner will be assessing you. They will take your necessary information from the paperwork and go into the porter cabin, where they will be discussing your case with the control centre GP, who is based elsewhere. To do this, we use an iPad connected to Microsoft Teams, and so we can talk to a clinician remotely. The initial observations are passed on to the GP in the control room, and the GP at the site will then go ahead and examine the patient. Usually this will involve the patient having to lean forwards in their car seat so that we can listen to the back of their chest. You will be asked to take deep breaths where possible. If a further examination is needed, we have a separate porter cabin to carry this out as well. The role of the control centre GP is to help coordinate the writing up of the medical records, as well as arranging any prescriptions that can be sent electronically to the patient's nearest or preferred pharmacy, in addition to arranging any referrals into hospital if it was required or deemed appropriate. All the information recorded in the medical records will go back to the patient's GP as well, and appropriate follow-up advice will be given to the patient and recorded in the notes. So that concludes our video, and I'd like to especially thank the University of Northampton, all GPA staff involved, and a big thank you to the volunteers from GP practices in Northampton. Thank you.